One of the things this virus has shown us is that there are limits to our medical and scientific knowledge. The novel coronavirus is moving faster than the world's best scientists. In Canada and around the world, they are toiling away in labs, doing the painstaking work of creating a vaccine and working to ramp up testing to find out who is infected and who might be immune. Never has the world been so focused on testing, and never has there been so much attention on the people who develop, administer, and analyze those tests.
Canada's done pretty well. We could have done better. I would have liked to have seen more testing early on to get a better sense of where we were. There's no doubt that early testing and contact tracing, finding those original cases, can have a big impact on the eventual spread because you're stopping it from spreading early on.
Dr. Michael Gardam was one of the leading figures in the fight against SARS in 2003.
Oh yeah, it's very different. I mean, in SARS, the technology wasn't nearly as advanced, right? So we weren't testing the general public at all for SARS. We were only testing people in hospitals who had compatible symptoms. And even then, we weren't doing it until the second half because we didn't even know what SARS was for the first half. So this has been very different. There was no community testing at all for SARS.
When those on the front lines talk about the importance of testing, they're actually talking about different tests, all of which could be key to reopening the world. The first is the Antigen Test, processed methodically in a lab. It tells us who is infected right now and could pass it on to others. The Antigen Test involves poking a long swab deep into the nose to just above the nasopharynx and rotating it. The goal is to collect microscopic material that's recently been in the lungs, which is where the virus is believed to replicate. The swab goes into a vial and is sent to a lab. We know there still aren't enough test kits or labs to test everyone.
That's really going to be one of our main strategies to get us out of the mess we're in right now, which is if you can have easy access to a test, even if you've got mild symptoms, if you're positive, then we know to tell you to go home and isolate for 14 days. And we can also tell your contacts to be wary for symptoms. If we can do all that, then we're much more like what South Korea has done from the very beginning, which is a lot of testing and really doing a lot of contact tracing. And they've been able to keep a lid on this pretty much better than almost any other country.
There are more rapid tests on the way. Health Canada is analyzing a portable rapid test made by Spartan Bioscience. It uses a throat swab, and in a device about the size of a coffee cup, it's said to deliver results in minutes. In the U.S., the FDA has approved a rapid test, too, made by Abbott Laboratories. It also claims to deliver results in minutes. It's being used by the White House, but there are concerns about accuracy and scaling it up for wider use. In addition to diagnosing patients, there's another kind of test that's being developed and scrutinized in Canada. This one is a blood test for antibodies, which reveals whether you've had the virus in the past, possibly without symptoms, and are now potentially immune. Health Canada plans to test it first in healthcare workers and select populations. Once approved, it could allow you to safely return to work. And the more people that are in that category, the more the economic engine can start revving again.
So I think I do see this as a sort of the light at the end of the tunnel, which I know has been used by many people in terms of how do we actually forge a path back to what life used to be.
Jim Woodgett is Director of Research at Mount Sinai Hospital in Toronto. The team there is developing a new and faster blood test to detect antibodies.
And the important thing is to try to identify, as people have the virus and recover from it, a lot of people actually don't even know, or they have very mild symptoms, and so they're actually immunized against the virus.
But, and it's a big but, it is not yet 100% certain people with antibodies will be immune, or how long immunity would last. The virus could mutate, so the optimism is an educated guess right now.
Absolutely. The more data points we get, the more accurate a model becomes.
Dr. Craig Jenny is an epidemiologist at the University of Calgary. He says the antibody test could help in the development of a vaccine, but the reality is a vaccine could still be a year to 18 months or longer away. Until then, we could be confined to our bubbles. Physical distancing remains the most effective way to slow the spread.
I honestly don't know if we're out of the woods until we have either a therapy or a vaccine. Because even if we get the numbers down so that there's no community spread, for example, in Canada, as soon as we return to normal life, open the borders back up, if there's other hotspots around the world, it's going to come back.
It's possible the virus could, in several months, be contained enough to start relaxing some restrictions on our lives. For now, the restaurants, theaters, malls, and countless businesses will stay dark as we wait for the doctors, researchers, scientists, and public health experts to lead us back into the light. With me now is Dr. Tasleem Nimjee. She's Director of Medical Innovation at Humber River Hospital in Toronto. Dr. Nimjee, thank you so much for all you do and for joining us. You've been treating patients with COVID-19. You're on the front lines of this. We've heard Canadian hospitals are still coping, have not been overwhelmed. What's it been like for you?
I think that's fair to say. We certainly are coping. I think we've created a lot of capacity in the system that's helped us certainly in terms of dealing with the traffic now coming into the system. And in addition, I think certainly we can see when we're looking at our numbers and doing our modeling, the efforts that we have in the community are really helping, and that's in terms of folks social distancing and not being out and about is making a big difference. And of course, we say that not to suggest that it's made a difference, it continues to make a difference, and so it's crucial that we continue to do those things.
Yes, can't repeat that message enough. In Ontario right now, it looks like about half of people who have been hospitalized end up in intensive care. Can you give us a sense of how you assess who to move into intensive care, what their symptoms are, at what point that you put them on a ventilator, just for those of us who aren't in that setting?
Sure. So when people are coming into hospital, the main symptom that they're expressing is really shortness of breath. That's what drives people to leave their homes for the most part and come into the hospital looking for care. And so when we're trying to determine what these people need in terms of hospital care, if someone requires oxygen, that's given through many different delivery mechanisms. So if you require supplemental oxygen through a tube that's in your nose or a mask that's covering your face, you might be able to just manage then on an inpatient bed, so be on a ward in the hospital. But if you're requiring higher and higher levels of oxygen so that those delivery mechanisms are no longer going to work for you, that's when we look at putting you on what we call a ventilator or a breathing machine. And what that really entails is sedating somebody completely and then putting a tube, we call an ET tube, down that person's throat into their trachea or their breathing tube or their windpipe, and then attaching them to a machine that's doing that breathing for them and allowing us to give higher levels of oxygen to that individual.
Dr. Nimjee, what concerns you, worries you most about this virus?
You know, there's a whole host of things we're looking at. This is novel, so we don't have immunity in our communities, which is why so many of us are getting sick so quickly. There's still a lot that we don't understand about why some people get sicker than others. There's the things that we do know, for example, the comorbidities that you've heard about, people with pre-existing health conditions, but there are young people that are getting sicker than others. So why do some people have milder illness than others? Certainly there's a lot of anxiety and worry about lack of other treatments, this being so novel, and then not having a vaccine. And so the big question is, how do you safely start decreasing some of the measures, the tightness on the measures that we have in the community to allow some of that normalcy to come back as the weeks and months progress? And how are we going to know that we're doing that safely so we're not putting ourselves again at risk of a second surge, as we call it?